This morning, the coronavirus proving to be unpredictable as the nation's top health experts try to pin down who's most at risk.
Now, as we're seeing weeks move into months with this crisis, we know that a lot of our initial thoughts were not accurate. We are seeing some younger folks who can get hospitalized and can also get very sick.
Information out of China initially pointed to older people being hit the hardest, but the latest CDC data paints a different picture. Patients between the ages of 20 and 54 make up nearly 40% of COVID-19 hospitalizations in the U.S., with 12% of intensive care patients between the ages of 20 and 44. What's not clear is how many of the young patients had underlying conditions, making them more vulnerable. The death rate among this younger group remains far lower still compared to those 65 and older.
No matter how young you are, if you have an underlying serious medical condition, you're going to potentially get into trouble. But if they don't have underlying conditions, that will be something we have to really examine as to why we're seeing it here, but we didn't see it in China.
He's fighting for his life.
Zachary Baron Shemtov's husband, David, was hospitalized after he became sick. A week later, and the 44-year-old who has asthma is now on a ventilator.
Just taking it, day by day, hour by hour.
College students who packed beaches and bars over spring break widely criticized. Now, a Florida university says 5 of its students have tested positive after returning from vacation.
Young people can get it. You will get sick.
New York's Governor Andrew Cuomo noting more than half the cases in the state are people between 18 and 49. A country relying on a younger generation to be responsible, reeling at the prospect that they too could be at risk.
And as a doctor told me, there is no textbook for the coronavirus and how to handle it. They're figuring this all out in real time. Now, here in Texas, Dallas has issued what they're calling a shelter-in-place order. That takes effect later tonight. So far, the state's governor has yet to extend that order for the entire state.